Multiple sclerosis, also known as MS, is a condition in which the immune system eats away at the protective covering of the nerves. It is said to be a leading cause of progressive disability in young adults. My name is Dr. Mercy Korir, and on this episode of Health Digest, Gloria Milimu tells us more about this condition.
About 5 years ago, before his diagnosis, being rendered immobile and fully dependent on someone else to even do the simplest of tasks was the last thing on 26-year-old Dixon Jaeko's mind. What started as a headache before progressing to paralysis has now seen Jaeko confined to this wheelchair and a frequent visitor in hospitals.
It started with headache. Thereafter, I was paralyzed from neck down to legs. I went to seek medication in a real hospital. First admission, I stayed in hospital for 2 weeks. After 2 weeks, then I came back home. Started treatment for around 2 months. The ugonjwa ikaanza tena ikarudi. Nikarudishwa tena hospitali. Nikakaa hospitali for 3 months, 3 weeks. After 3 weeks nikakuja nyumbani tena. Nikakaa for 2 months. At that time, I'm paralyzed kutoka neck mpaka chini. So nilikuwa nalishwa, kila kitu nasaidiwa, everything. Ikarudi tena mara ya 3 yenye ili paralyze mpaka muscles za chest. Nikapelekwa ICU for 1 month and after hapo nikakaa ward 6 months. Ndio sahi nang'ang'ana na recovery. So nimetoka ward, ICU ward, then niko sasa kwa recovery.
Before his diagnosis with multiple sclerosis, an autoimmune disease in which the body's immune system attacks its own tissues, Jaeko had been mistakenly diagnosed with a different disease. And with each passing day, his health deteriorated and the hospital became his second home.
The first one, walikuwa wameanza wakasema ni transverse myelitis. Alafu wakakuja wakasema ni multiple sclerosis. So ni a nerve disease yenye ina affect, yenye ni autoimmune. So generally niko na shit, yani nasaidiwa everything kama turning na niko na shida tena na kucontrol pot bladder and bowels. Yeah. So far matibabu imekuwa ngumu juu ya corona. Tunajaribu kutumia kutafuta dawa, lakini imekuwa ngumu juu ya finances na everything. The whole bill, the entire medication ni 3 million na hatujamaliza, na bado kuna medication ya daily use. So hivyo ndio imekuwa ngumu.
Multiple sclerosis has not only taken a toll on his health, but also cut short his career aspirations. At the time of his diagnosis, Jaeko was a third-year student pursuing a bachelor's degree in commerce.
Sahi watu wenye tulisoma nao wali graduate, wengi wa makazi. So mi sasa inani affect juu ukiona wanaendelea na bado umebaki hapo. Obvious utaona ni ngumu yani hata nakosa tu ya kusema juu nikiimagine hii majaribu yote, so nashindwa. First 1 year ilikuwa inani affect juu sasa unakaa alafu unafikiria kama ulikuwa unaendelea vizuri, alafu all of a sudden ukakonjeka, alafu hautembei. Unajua sasa hiyo unafikiria vitu mingi, unaanza kufikiria kama Mungu yuko, vitu kama hizo. Lakini sasa from therapy nini unaanza kupata hope. But initially nilikuwa nimelose hope. Nilikuwa naona tuacha tu nimalizie hapa maisha yangu.
And just like any other patient with a lifelong condition, the cost of medication remains a nightmare for Jaeko's family. Having exhausted all its financial avenues, the family now depends on well-wishers to help keep him alive.
Kununua dawa na kumpeleka check-up. Dawa mara ya kwanza wakati alidischargewa 2018, alidischargewa mwezi wa pili. Dawa ilikuanga 20,000, 12,000, 15,000 per month. Dawa peke yake bila chakula. Sasa tumestruggle na wakati alidischargewa hatukuwa na pesa. Tukapata pesa kidogo. Bili yote ilikuwa 5 million. But tukajaribu kidogo tukapata 2 million, 3 million ikabaki. Tukatumia title deed. Nikaomba my brother title deed. Tukamfungua kwa hospitali. Tukawacha title deed ya my brother huko Real Hospital. Tukakuja tukapata changamoto kubwa ya kununua madawa. Hatukupata pesa ya kulipia bill ya hospitali. Alafu tutoe title deed ya wenyewe. Sasa tumekaa, pressure ya kununua dawa imekuwa ngumu. Pressure ya kulipa bill kwa hospitali alafu title deed ya wenyewe ikuje imekuwa ngumu. Kila kitu imekuwa ngumu mpaka saa hii, ingawaje dawa imerudi chini kidogo, si mbaya. Tunalipa sasa 10,000 per month kwa dawa peke yake. Sasa challenge kubwa ni wakati ya COVID, tukaenda hospitali 2020 mwezi wa 3. Daktari akatuambia mkae nyumbani juu ya COVID. Sasa tuko nyumbani kidogo, mimi mwenyewe naenda kumwambia daktari filako. Ndio yeye mwenyewe sasa ako nyumbani. Imekuwa challenge kubwa, hata kupata gari ya kumpeleka hospitali ni ngumu. Kununua dawa ni ngumu. Na sina kazi, niko nyumbani. Tungangangana tu nyumbani, hatuna kazi yoyote. Ni kutegemea tu well-wishers, maziwa kidogo, nguku kidogo. Ile tu ya kawaida ya mama akiwa nyumbani. Sasa naomba well-wishers, watu wenye wameniona wanisaidie kulipa bill hata imekuwa shida zaidi. Hata kununua dawa ni afadhali, lakini bill imekuwa ngumu. Mpaka juzi my brother anataka title deed yake, kweli imekuwa ngumu, imekaa na amenisaidia for those years. About more than 4 years now. From 2018 to now. Na tunaomba Mungu siku moja amfanikie huyu kijana apate kuamka ili hata naye afurahie vile amekaa for those years wakati alikuwa university, amalizie shule yake, masomo yake, hata atembee tu.
My name is Gloria Milimu, and to help us understand more about this autoimmune disease is Dr. Kinoti Ndege, who is a neurologist. Daktari, if you can just start by explaining to us what is multiple sclerosis.
Multiple sclerosis is an inflammatory disorder of the central nervous system. That means it's a disorder which affects the brain and the spinal cord, which are the main structures of the central nervous system. And it's mediated by your immune system. So in one sentence, one can say it's an immune-mediated inflammatory disorder of the central nervous system.
So what are some of the symptoms that somebody should look out for?
This condition has got multiple symptoms. As you are aware, your brain controls all the aspects of your body, really. Everything is a central control point of your body. So anything that goes on in your body is regulated or mediated by your brain. So when something goes wrong in your brain, the symptoms are numerous, but they mainly involve motor symptoms, where you are unable to walk or you have trouble with movement. Then you may have problems with balance and coordination. You may have sensory symptoms. You may have numbness or sometimes tingling, sometimes pain. You may have bowel or bladder symptoms when the spinal cord is affected. It may affect your vision if the optic nerve is affected. It may even affect your emotional or psychological side of things, because your brain really is the center that controls all those factors. So to a patient, some of the things you might find is you might develop weakness of one of your limbs. You might develop numbness. You might develop tremors or loss of coordination. You may develop poor vision. You may have trouble with controlling your urine or your bladder or your bowels. The precise cause of multiple sclerosis is not really known. But what is known is that it's a complex interaction of multiple factors, both within you, that is genetic factors, and within your environment. So you may have a genetic susceptibility or a tendency or a likelihood of developing MS, but something in the environment has to trigger that development. What precisely this is still being worked out, but people postulate that there could be issues to do with the environmental where you are, for example, because MS is much more prevalent in the extreme latitudes, especially towards the north. So countries which are at the far north, in the Scandinavian countries and such places, they have much higher levels of MS than places near the equator. So it is though there's something to do with geography. And this geography is not clear, but probably something to do with the levels of sunshine, amounts of vitamin D present. But there are also theories about possibility of infection. There are some viral infections and other things which are thought that they might mess up with the immune system and trigger this kind of thing. There may be issues to do with the diet. So the exact causal mechanism has not been elucidated. MS is a varied disease. There are those who get highly aggressive forms and they are really going to be unwell and probably might progress to disability within a very short time. There are others who get quite a benign form, where they get very few infrequent attacks and they're able to live without major complications. Now, the most important thing for the patient is to first, if you have already been diagnosed, is to watch out for relapses. Make sure that if you get any relapse, it's treated early without any delay. Because the longer you delay, the more the disability is going to set in and it may be difficult to reverse it. So treatment without delay.
So when a patient walks in here with some of these symptoms you've talked about, what does the diagnosis entail?
Now, the process of diagnosing multiple sclerosis is not an easy process. It is often very difficult to diagnose it at the initial presentation, because there must be a criteria of things which must be met. So the very first thing, of course, you got to listen to the patient, hear what their complaints are and what has happened and the duration, find out if it has happened before, because you must show multiple involvement, multiple episodes of this condition. So you got to find out if there's been similar involvement before this. Then you got to examine the patient, find out exactly which areas are involved and what is happening. Then you send them for the relevant test. The most important test will be an MRI scan of the brain or the spinal cord, whichever area you might be interested in, or both areas. And this might show you the plaques, which are usually found in those areas. So when you find these plaques being present on this imaging, then you really have a a good case that this could be multiple sclerosis. Sometimes things are not so clear and you have to go and do even more investigations, like a spinal tap to get some fluid from the spine, which is going to be assessed and seen if there is any indicator that it's got multiple sclerosis. There are conditions which can look like it, so you've got to rule out other things. So you've got to make sure the person, you've got to do tests for HIV, you've got to do tests for vitamin deficiencies, you've got to do tests for other infections, just to be sure that there's nothing else which could be looking like multiple sclerosis that the patient has, which might be treated and the condition is managed. For conditions like this one, which are really immune mediated and you really cannot isolate, say, a particular germ or a particular organism which is responsible, it is difficult to talk of eradicatory treatment, where you say, I've treated this person and the person is cured. So it is really a long-term chronic condition. One of the types, because it's got 4 different types of MS, one of the types is called, the most common type is called the relapsing remitting type of disease. And this one comes with multiple episodes at multiple times. So you may treat the patient this time, and then they'll get another episode after 6 months, after 1 year, after 2 years, and so on and so on. So cure is not really possible currently, but there's treatment to manage things and to suppress the inflammation. So treatment is available, and what you do is you use things like high doses of steroids at the beginning to manage the initial relapse of what is going on. Then there are other medicines which may be used for long-term management to suppress and prevent recurrence. Some are available, but many are not available in this country, and they are really very, very expensive. So this remains a big difficulty for patients with multiple sclerosis in this country.
In terms of demographic, is there a particular group that is mostly affected by MS?
It seems to affect the female gender a little bit more. And it often starts during the younger ages, early on in young adulthood. But it can affect any gender, and it can start at any age. But the peak ages are going to be in young adulthood, and most affected are of the female gender. Patients with the MS or any other chronic condition are more at risk from COVID-19, from getting severe disease or symptomatic disease with COVID-19. As you have seen, the people who have been most severely affected are those who have other ongoing comorbidities. So every patient with this kind of condition really needs to adhere seriously to the preventive measures. And one of those preventive measures is having the vaccine. So far to my knowledge, there has been no reason why patients with multiple sclerosis cannot have the vaccine. Sometimes if they are receiving immune modulating medication at the same time, they may not have probably a very effective response to the vaccine, meaning that the protection may not be as good as they might like it. Maybe there might be reason to boost their vaccine doses later to make sure that their response is as good as patients who are not on immune modulating medication. But they should have a discussion with their doctor so that they can decide at which level of treatment should they get the vaccine. If one is probably getting high doses of steroids plus other things, then the vaccine response may not be as good as they might have wished. So it would be wise to get it when the relapse is over and things are under control.